Hello friends, welcome back to Lybrate. I am Dr. Hanish Gupta and today I am going to talk about diabetes and kidney disease. Friends, all over the world, now number of patients are started to having dialysis. A number of patients are undergoing kidney failure. This has not happened suddenly, but it has happened because of two very important illnesses that has grabbed the world today, diabetes and blood pressure. Out of which diabetes forms the biggest number of patients who developed kidney disease, and today for end stage kidney disease, diabetes is the number one illness that afflicts people in USA. India is also fast approaching that unfortunate scenario. People believe that in diabetes, when they get their kidney function test done and the kidney function test comes out to be normal, then it is everything okay with their kidney. But that is not the case. Kidney starts to show sign of deterioration in diabetes very early on, and it is very important for the doctors to catch hold of that critical point of time in the early phase of patient's illness to decide that whether the patient is really undergoing any kidney deterioration or not. That test is urine test. Very early on in the scenario of a patient having diabetes, there is microalbuminuria, which is the passage of albumin, which is a protein, from the body in very small amounts. That is the period of time when the first stage of kidney failure actually sets in, and that is also the important time that if proper intervention is done, then kidney can be saved from deterioration of function later on in life. People keep on getting their kidney function test done and believe that what they have got done is actually the real test, but it is actually urine albumin creatinine ratio or urine ACR, which is done by standardized methods in different laboratories, that actually details to us that whether the patient has actually started developing kidney disease or not. The important thing to consider is that not only test but also symptoms and signs of the patient can tell us that whether the patient has started to develop kidney failure or not. People believe that it is actually the urine passage or the amount of urine passage that decides this factor. But the most important factor in this case is actually the swelling over the body. In fact, even a subtle sign like loss of appetite can also detail that whether the patient has started to develop kidney failure or not. In this case, I will tell you a very interesting thing, that when actually there is kidney failure in the body or the kidney has started to show deterioration, then the patient starts to show a tremendous amount of relief in sugar controls, meaning by which that the medicines that he is taking for sugar, the dosage of that medicine actually goes down, and patient starts to believe that since the sugars have now started to getting controlled, that the patient is actually improving. But that is not the case. It is actually kidney deterioration because of which the patient has started to have better controls over the sugar. The thing is like this, that insulin is eliminated from the kidneys, and when the kidney is undergoing deterioration, at that point of time, the time period for which the insulin remains in the body, that increases, which we call the increase in the half-life of insulin. And that is why patients who are having deterioration of kidney function, they start to show better control with sugars. So with these points, which are very important and pertinent points for your treatment, keep your kidneys healthy and keep your diabetes under control. You can visit me anytime at my clinic at Mayur Vihar, or you can come to Lybrate for any time online consultation. Thank you friends.